Hi, this is Lara Klick from Klick Advisors. Today I'd like to talk about a topic that we don't always like to bring up, and that's violence in the workplace. Anyone who's been in their industry where you interact with people knows that especially in the last few years, there has been a substantial change in the way that you interact with people who come to you for your assistance. We're seeing heightened tensions, increased violence, and a world that is shifting to a reactionary workforce. So what I'd like to talk a little bit about today are solutions for how you can give your team tools to be able to absorb and respond to this potential violence in a more effective way. Let's start by talking about what I'm saying related to violence in the workplace. So there was a study that was done by Press Ganey, one of the largest survey vendors in the country, that estimated that currently 2 nurses every hour are assaulted in American healthcare. And if that statistic is stunning, I'd like you to consider the fact that the current estimate is that 88% of verbal and physical violence goes unreported. Those numbers are staggering. I can tell you as someone who's been in the field for almost 30 years that I've seen a significant change in the way that the public interacts with healthcare providers. It's most stark since the COVID pandemic. At the beginning of COVID, I was right there at the front lines in the building, trying to make sure that as a part of our healthcare system, we were helping our community through this really terrifying time. And we were heroes. People brought us meals. They had boat parades outside of our organization. They had Jeep parades that came around the front. People sent us notes and letters of thanks and identified us as being people that were there to help them. And suddenly we went from heroes to zeros. The amount of vitriol increased. The number of people who began to doubt the recommendations that we made increased. The rage bait that you saw on social media increased, and we saw people that were coming in and having explosive interactions with us much more frequently. Now, this is not everyone, and let me make it clear that the vast majority of people who see healthcare providers do so because they genuinely have a trust bond with that provider. They're coming for assistance. 99.9% of the time, the interaction is collaborative. It's a situation where we are mutually moving towards a single goal. The problem is that 0.1% of the time, when it happens, first of all, sits so deeply within the soul of a relationship-based provider that it's what we remember at the end of the day. Secondly, when the violence does actually erupt and happen within the workplace, the ripple effect of team members becoming injured is massive throughout your organization. It's not just the person who was the victim of violence. It's everyone who knew that person and everyone who heard about that violence. So if you're someone who's in a position of leadership in healthcare, it becomes essential that you have systems and processes in place to address the threat of violence and actual violence within your walls. So let's look a little bit more about what is the cost of not addressing this information in your building. Well, first of all, we know that healthcare workers are 5 times as likely to be victims of violence than almost any other workplace. There are a couple of places that do see violence occurring, first responders most notably. But also, if you think about it, the likelihood of a healthcare worker becoming seriously injured is one of the highest in the workforce. Your credibility is on the line. Your credibility as an employer and as a protector of not only your team, but also your other patients and the other people within your walls. So like everything else, I'm going to tell you that systems and processes trump philosophy any day of the week. You need to put in place systems and processes to do several things. So I will let you know that there are 3 things that you need to do as someone who's in a position of leadership and authority. The first is that you have to create systems and processes to ensure that you are recognizing potential friction which can lead to explosive interactions and potential violence. Secondly, ensure that you have skill set training for your team from day one so that they're never placed in a situation where they're not sure what to do next. They need these skills because they are tools in the toolkit to recognize when can they de-escalate a situation and when do they need to get help. And then finally, what I want to spend the majority of my time on today is what I call the action model. So this is a practical, tactical way that healthcare organizations and other relationship-based organizations can systemically look through the potential of violence and address it before someone gets hurt. So let's dig in. So you need to take action. I love my acronyms. The acronym for this is ACTION. So let's walk through each step in our action process. The first is to assess those potential risks. So do friction analysis within your organization. And how you do friction analysis is actually fairly straightforward. You have several ways that you can do that. The first is ask. Your customers and your employees know where the friction is. They see it every single day. Be thoughtful and deliberative in how you ask. Don't only depend on a survey tool. What you want to do is you want to actually bring in people to sit and provide you with focus groups and to walk you through every stage in a process and identify, was that smooth? Was that something that hurt a little bit? Was that something that was almost impossible to achieve? Go through your friction analysis somewhat like going through a journey map, but instead of just mapping out the process steps, you're mapping out the process steps and how easy it is to accomplish that process. You're going to focus group with your customers, but also focus group with your team, the people closest to the process. Ask them open-ended, thought-provoking questions like, what are the things that you see that create the most consternation in your customers? In addition to assessing the potential risks in terms of friction analysis, partner with your security partners to walk through the process to see potential danger. Are there things that can be weaponized? An emergency department is a great example of that. If you're hanging art on the wall of an emergency department, which is a wonderful technique to take because it creates a more soothing environment, the way you anchor that art into the wall is important. Make sure it's not something that can be taken off a wall and weaponized. And I use emergency departments as an example because that is a place with high levels of friction, high levels of anxiety, high levels of potential violence. I remember early in my career, everyone was bringing pagers into their emergency departments. They figured the restaurants do it, healthcare can do it too. So you would come in and you would give your chief complaint and you would receive your triage from the triage nurse. And when they finished their assessment, they would give you the pager, sort of like Outback Steakhouse, and say, go ahead and have a seat and we'll page you when it is your turn. Have you ever gotten a pager when you were a patient? Yeah, it was not well received. Our patients hated the pagers. They said it wasn't a restaurant. They were in crisis. They weren't going for a steak. And I can tell you that multiple times that pager that we gave trying to be helpful became a projectile that was thrown at the head of the people at that triage desk. So be very thoughtful in the physical environment as you're assessing potential risks. Finally, you have to recognize that there are times like the emergency department or behavioral health, or when you're giving a devastating diagnosis, or if you are a leader in an organization, are you giving a disciplinary action against a team member? These are times where the level of stress and tension are going to be heightened, and you have an increased risk of potential violence. Assess your potential risks. So let's move to the C in our action steps. So if you look at C is creating keywords and escalation plans, specifically based on those times where you see that high potential, but also for the times you missed. So giving people keywords of what to do when things get heightened, and the language to use which is effective, and the language which actually will make it worse, that's a really critical thing for you to do as an employer of people who have potential risk of getting hurt. In fact, I would say that training needs to start on day one of employment, because you don't know when that risk is going to erupt into a violent situation. And be careful, because if you allow for the informal training that I guarantee you is taking place right now within your walls, you're not sure what the standards are in those situations. Are your team members telling their colleagues as they're being onboarded, "Oh, don't even worry about it. We have so many difficult patients. We just ignore them"? Are they saying, "Just call security and they'll throw them out. You don't have to worry about it"? Or are they saying to the person, "Well, here we use the state methodology to make sure that we're communicating well what the expectations are. And when people begin to escalate, as long as it's not dangerous, we move into our caring framework and we try to redirect them and set a limit. But when we reach a point where it's dangerous or destructive, we move into tell." So are there concrete ways that you've educated your team on how to take this potential violence, assess it, and then use the words that work? We don't say it's policy. We say for your safety, we. We don't say no. We say unfortunately. We don't say you can't. We tell people what they can do. How have you built those key words and then the escalation plans? If I redirect and it doesn't work, this is where I go next. C, create keywords and escalation plans. So have you given the tools? Have you trained from day one on what the key words are? Do you tell people no, or do you say unfortunately? Do you tell people, well, it's our policy, you have to? Or do we say, for your safety, we ask that you? Do we say you can't? Or do we tell people what they can do? And when things are appearing to be dangerous, destruction, or something that you're concerned about, do you have a concrete escalation pattern, and is it followed? Do you practice that concrete escalation plan? How do you communicate it? And when do you communicate it? Do you communicate that from day one? C, create keywords and escalation plans. Then we move to the T side. So I talked about the importance of training. How do you train the team? Where does that training take place? Are you training in a way that you're just checking a box, or are you training in a way that you're going to create a skill set that is replicable within your organization? I'm going to tell you that conflict is something that is not ideally delivered in a computer module or a technology where people are kind of passive learners. If you are going to use computer technology to deliver this, make sure that it's an interactive technology so people can practice the skill set as they're learning it. This is a skill set which is unbelievably difficult for people, especially people in caring professions. You can't just tell them what to do. You have to explain the why and why it works. And then for each step in the process, ensure that you're giving them an opportunity to practice and practice repeatedly, and then practice again, and then practice with a safe person, and then ensure that as they're implementing it, you have someone who's an expert, who's observing and coaching and helping them through it. This is not your typical skill set training. This is asking people to do something which is actually against their natural response of fight, flight, or flee. And be aware that you have to assist them through that discomfort. So when you train the team, be alert to how that training occurs. Be alert to when that training occurs. Again, the earlier in somebody's tenure, the more effective it's going to be. So ACT in action is the proactive component that we're discussing today. If you act very well, hopefully you won't have ions. But I'm also a realist. I've been doing this for a very long time. Things will happen. And so when things happen, there's a secondary component to what we're discussing. So if you have a situation where there has been verbal or physical violence that has occurred, you need your leadership team to also have skill set training on what do you do next. So for example, let's go back to that emergency department. Let's say that we have someone who threw a chair across the emergency department towards the triage desk. Whether it struck someone or not, that was a traumatic experience for everyone in that emergency department. They immediately went to, what if it wasn't a chair? What if it was a gun? What if it was a knife? What if? So now you have a situation where you're not just managing what actually occurred, you're managing the what if. And your response in that moment is essential to ensure that your team feels safe, secure, and supported. So let's talk about the I in action. So with the I in action is that you are going to investigate the event that occurred. But here's the critical component. You do so with compassion and empathy, and you acknowledge the psychological impact of what has occurred. So too many times in my career have I seen leaders go into a situation after you've had a bad event that occurs, and they start with, what could you have done differently? That is at rubbing salt into the wound of somebody who already has been psychologically injured. You never want to start with, what could you have done differently? That, in point of fact, is not a question you want to have on the table initially during any conversation. If they self-actualize, you can drill down on it, but that's a question you never ask. So when you're investigating events with compassion, first of all, it happens fast. If someone is injured and badly injured, do not underestimate the importance of personal presence. Someone needs to go in. Someone at the highest level possible should get there as quickly as possible to ensure that there is a leader that is there to help through the psychological damage that has occurred. Secondly, you want to start with, what could we, i.e. the organization, have done to better support this event and prevent it from occurring. So you go to systems and processes. What could we, the organization, have changed? And that's your point of curiosity. And the person may say, oh, I wish I had had better training, or I called security, they didn't arrive fast, whatever that may be. And again, you look at that from a systems and processes perspective, not a people perspective. Don't create a second victimization of the person who is involved. So I investigate events with compassion. Once you do that, you move to O. And O is, again, happening as quickly after the event as possible. And that is offering post-event support. You're not offering blame. You're not telling someone you have to go see EAP. Instead, you're saying, we recognize that this is disturbing when an event like this occurs. We're going to bring in support for everyone. Train a rapid response team who can go in in the right now. That's usually a leadership team. You can use the RISE model. There are other models out there. Have internally trained experts on what to do in the moment. But then what's your long-term plan? How are you going to help people process this? Not just today, but tomorrow, next week, and next month. Have a plan in advance of what you're going to do to have ongoing dialogue and ongoing follow-up with that team and your entire team. Once you've identified the systems and processes which could have been enhanced, which perhaps led to this, communicate widely. We've changed this, we've changed this, we've changed this. Make sure that your team has an opportunity to process, to verbalize their fear, to work through that with professionals, and then to hear we've made a difference in what giving our feedback. And then finally, you need to make it a cultural expectation that the N is always in place from your action model. You will never let violence become status quo. 100% of the time, if somebody has physical violence, you are going to encourage the person to press charges. It's never okay for someone to become violent. Likewise, you're going to ensure that anyone who threatens violence against the team, there is an immediate reaction where you're going to have, I used to call it my partnership, my security director and I, and it would get up to the senior level like me. And we would go in together and we would have, in no uncertain terms, a critical conversation with a patient who threatened our team. If it was a visitor who threatened our team, that person was excused from the building for a cooling off period, and then they had to meet with us before they were allowed back into the building. Did we always trespass someone who would threaten violence? No, but we had to do a very clear assessment of the potential of that person following through on that statement. If we thought there was even a hint of a possibility, then that person would only be allowed in for true life and death situations. We did have situations where we allowed someone in who we felt was a threat, who had threatened our team. But when they came in, they went to our security department, they were searched, and they received a security escort to go up to say goodbye when their loved one was dying. But they had 2 security guards present for that interaction, and the team saw and knew that we were taking it that seriously. I would say that if it's not truly a life and death situation, birth and death are things you can never get back. And we tended to be more forgiving in terms of allowing people in, not forgiving in terms of what had occurred, but allowing people in with that security escort if it was someone's final hours. If somebody was in for a hip replacement, they could give consent via phone. And so that person was excused from the building, usually for a period of a year, if they made any threats against our team. So never let violence become status quo. Teach your team never to let violence become status quo. Anyone who jokes around about violence, there is no joking about violence, period. So that's not okay. And make sure your team knows that. So the N for action is never let violence become status quo. And make sure that your team knows that and they know that clearly. So hopefully you've taken action to create a safe workplace for your workforce. You've assessed potential risks. You've created keywords and escalation plans if things begin to become tense or problematic. You've trained the team on what to say and what to do and how to get help and when to get help so that they are comfortable in escalating things to that next step. If something does happen, you've investigated that with compassion, never investigating it in a blameful way. You're not starting with people, you're starting with systems. You're offering post-event support. You're never providing post-event blame where it's somebody's fault. And you're bringing in immediate peer support and then long-term professional support for anyone who was a part of a violent exchange with someone. And you never let violence become status quo. Through those action steps, you can create an environment that is a healing environment, and you can minimize potential risk in your team. Don't let your team become those serious injuries. You'll never avoid it 100% because things will happen that you don't expect, but mitigate that risk as much as you possibly can. So take action for your team. Find a way that you can take action in advance, proactively, and hopefully you don't have to react. This has been Lara Klick. I hope you found this helpful. I welcome your feedback on future topics, and I wish you the very best of days.